Hey everybody, it's Ken with AMN. So this article came out today. It's hot off the press, everybody. Um, I just kind of wanted to kind of go over it quick if you haven't seen it. It's interesting. So SwanBio Therapeutics out of Philadelphia. They're currently working on the gene therapy trial for men with AMN, and they did a healthcare resource use study. And in this article, it says it's confirming the substantial burden and economic impact of AMN on both men and women. Which again, I think for women, they're really looking at what we're now calling symptomatic women with ALD. Um, these findings demonstrate that the standard of care for AMN is not enough. These patients need and deserve more. And, I'm looking at this from a guy who has AMN, who's now I haven't been through the ringer per se, but I've been at this now for almost 8 years since I was diagnosed. So it's interesting. The real world data we have gathered illuminate the under-acknowledged burden of AMN. Affected individuals are experiencing more comorbidities, higher rates of hospitalization, substantially more prescription fills, higher overall healthcare costs, and poorer clinical outcomes than their peers, said Tom Anderson, Chief Executive Officer and Director at SwanBio. These findings demonstrate that the standard of care for AMN is not enough. These patients need and deserve more. So the study was based on a retrospective review of commercial insurance and Medicare claims, comparing resource utilization and health outcomes of men and women living with AMN to those without AMN from similar demographic groups. So, the very first one, the key findings: adults with AMN experience more comorbidities, including peripheral vascular disease, and then it gives a percentage here. If you look at these percentages, at first I was really confused, but so they're basically saying 4.6 of men with AMN would have that. 0.9% of people without AMN would have that. Women, 2.2% versus 0.5%. And then they go into chronic pulmonary disease and liver disease as well. So it's like, that's interesting, definitely. And it's like something that I've never seen published as far as the other things that, men experience with AMN. And then a significantly larger proportion of people living with AMN had at least one hospital admission. Men, that's 32% versus 6.1%. Women, 23.2 versus 7.2. We're going to knock on all wood. I haven't had an official hospital admission, so that's not going to be me, but I'm not looking forward to it if I do end up there. Commercially insured adults living with AMN, 18 to 64 years old, had dramatically higher annualized all-cause direct medical costs. This is especially true for men with AMN whose medical costs are approximately 10 times higher per person per year. That's kind of shocking. I mean, I know it's expensive, but 10 times. Men living with AMN also utilize significantly more prescriptions, 18.1 versus 5.4 pharmacy fills per year. I can relate to that. I'm at the pharmacy quite often, and that's just part of it. And, it's just like the cost, how I look at it, like I have decent medical insurance through my employer, but at the end of the year, every single year, I know I have to put up $1,000 towards the deductible. My company pays the rest, which is great. But still, it's $1,000 every single year that I know I'm pretty much going to have to put up if I want to go to the doctor and stay on top of things, which we do. So, and then the last one, this one's among those living with AMN between ages 18 and 64 enrolled in Medicare, mortality rates were higher. Men 5.3 times higher at 39.3% versus 7.4%. So basically saying the chance of dying between 18 and 64, it's 5 times more. Women, 15.7 versus 4.9%. And at age of death was younger, 9 years younger for men and 3 years younger for women. So again, I don't know the numbers that they're basing these numbers off of, like how many people did they look at, but everything that I know and all my kind of research of AMN and this seems probably likely the 9 years. I feel like I feel like even that number though, and the 3 years is still it's still too early to tell. And again, I know they did this study as well, probably to help out, with everything with the gene therapy, so they keep it moving. This just pretty much shows that there is a need in the community, and you know, I completely agree that there is a need in the community, and I don't think that it's looked. And then they go into AMN and SBT 101, which is the gene therapy. I feel like it's not looked at, and people don't realize, the difference of how much it costs. I mean, I think people realize the difference of someone who has a disease, but specifically AMN. Um, it's a very interesting article. So, but, and again, I say when I first looked at it, it kind of made me depressed. I'm like, to be a man with AMN to be compared to people that don't have AMN, and they're like, boom, 10 times the annual cost versus a quote unquote, as I'm going to say, normal person for this video. And then, the morbidity rates, and it's just like, we don't know. I don't want to talk about that, but at the same time, I think this is a great study, a great article to be out there, just for all good. So, but yeah, I will put a link to this full article in the description down below. So, Ken with AMN, keep those feet moving.